I'm often asked why a temporal lift is necessary in some patients. When we have a lot of central laxity of the neck and we're trying to elevate the skin upward, sometimes the patient that has a brow that's come down, you have the skin meeting in the area of the temple. And when that happens, it can look like it's excessive there, and it can accentuate the decline that occurs in the brow. When we have a patient who has the need for great vertical movement of the skin, oftentimes we need to deal with the excess in the temporal area. And so with a very simple small incision in the hairline that's probably 1 centimeter in length, we can actually suspend the temporal area, and we call it a temporal brow lift, and elevate the brow slightly, and then deal with that vertical excess of skin. You know, I often have the analogy that when we do a facelift, it's like spreading the sheet on a bed, and you have to be able to pull it in two to three different directions in order to spread it out, so it doesn't look like you have any vertical excess, it doesn't look like there's any pleating. And so sometimes it's necessary just to get a little bit of a lift in this area to make sure that you can spread that skin out so that it looks nice and smooth and flat and natural. Temporal lift's not for everybody, but when it's indicated, it's really primarily indicated in those patients who end up having a lot of vertical excess of skin, and in order for us to get a more natural result, we will often recommend it.